Reversing diabetes. Is it even possible? Now, while that idea is being debated among medical circles, people every day are actually reversing their diabetes. There's one thing that all the medical personnel agree on. Type 2 diabetes is a lifestyle disease. It's caused by things that we eat, things that we do. So in this seminar, we're going to help you identify what some of those things are that may have caused you to become a diabetic or have developed the symptoms of insulin resistance. And we will try to help you know what things that you need to change. We will, as we're talking about this, you will understand that there are changes that are going to be occurring in your body. You might see your blood sugar begin to trend down. Your energy levels go up. Blood pressure might come down. And you have an improved state of well-being. You can stop and even reverse the progression of diabetes with lifestyle changes. With increased health comes increased enjoyment of life. So what are we waiting for? Let's get started. In this course, we're going to talk about diabetes, what it is, and how we got there. We'll talk about nutrients, carbohydrates, the proteins, the fats that are in the food that we eat, how those things might cause inflammation and what part inflammation has to play in your disease process. We'll learn what impact your genes have on the disease and how to actually turn off the expression of some of your genes to give you a more optimal result. We'll learn about the role of exercise and how it can change diabetes, as well as how to lose weight without being hungry. Sounds good. Well, let me tell you about a reversal hero. Richard is his name. When he originally came to us, his hemoglobin A1C was 11.4. Now that's really high for a diabetic. And his sugars were well out of control. His weight was 217. His cholesterol was 207. And his triglycerides were 206. Again, high numbers. After being with us 6 months on the program, Richard had dropped his A1C almost to normal. It was down to 6.1. His weight had dropped by 10 pounds. Cholesterol was down, and triglycerides had dropped by 2/3. Just one example of what can happen when you adopt some of the principles that we talk about here. Let's talk for a few moments about some diabetes facts. Diabetes is currently the fastest growing disease in all of human history. The CDC has declared that it is a pandemic. It currently affects 20% of the world's population, and that disease rate is expected to double within the next 16 years. Diabetes in the U.S. is affecting millions of people. According to the latest statistics out from the CDC, there are 29.1 million people with diabetes. That represents 9.3% of our U.S. population at large. And in addition to that, there are 86 million people who have prediabetes. So, with that being the case, what about our children? The projection is that 1/3 of the children who are born after 2002 will die of type 2 diabetes, and they will die 20 years ahead of time. They will be the first generation to die off before their parents do, unless we take this in hand and do something to stop the progression of the disease. How much does it cost? Well, in 2007, they estimated that it cost us $174 billion in care of the diabetic patient, in lost time from work, and associated costs here in the United States alone. But by 2012, that number had jumped to $245 billion. That's a jump of 41% in just 5 years. What's happening now is very scary. My name's Steve Wickham. I work as a registered nurse in a hospital. I work with these people every day, and I see them coming in over and over and over again with these problems. Now, there's different types of diabetes, and we are focusing specifically on type 2 diabetes. But before we get there, let's just run down and tell you about the different types of diabetes and what they are. Type 1 diabetes is the form of diabetes that's often known as juvenile diabetes. It has its onset in childhood, and these people are hurt because their immune system has become active against some of the cells in their body and is actually destroying the beta cells in the pancreas, which produces insulin. So they are actually no longer able to produce the insulin that they need. Then there's insulin-resistant diabetes. Now this is actually a spectrum. The spectrum begins with insulin resistance. It can occur many years before you actually develop the symptoms, and those symptoms can begin, the destruction can begin actually before you begin to experience the symptoms. Then you have prediabetes. We have a lot of names for this. Some people call it metabolic syndrome. Others call it syndrome X, and others just refer to it simply as insulin resistance. Then there's gestational diabetes. A gestational means while a woman is pregnant with her child, she develops diabetes. It's like a type 2 diabetes, blood sugar's out of control, etc., all the symptoms, but it resolves spontaneously once the baby's born. It's usually a wake-up call, indicates that possibly within the next 10 to 15 years, she may convert and become a full-blown diabetes if lifestyle changes do not change. And then finally, we have what we know as type 2 diabetes or adult onset diabetes, which is what 95% of the population suffer with currently. So what are the symptoms of prediabetes? You may have prediabetes and not even know it. And if you are a man and you have a waist circumference of greater than 40 inches, or a woman with a waist greater than 35 inches, you may be prediabetic already. If your triglycerides are over 150, you may be prediabetic. Blood pressure greater than 140 over 90, actually blood pressure is one of the first symptoms that a person is becoming insulin resistant. And that's why so many people have blood pressure problems today. Then there's cholesterol. If your cholesterol is greater than 200, you probably have prediabetes as well. There are others. Hemoglobin A1C. We know now that actually eye damage begins with a hemoglobin A1C of as low as 5.5. And yet in the medical circles, they oftentimes will say, well, you're in good control if you're below 6.5. What we're aiming at is not control, we're aiming at reversal. So we need to get that down below the level where damage actually occurs in the body. We'll show you how. Fasting blood sugar. If it's greater than 100 when you wake up and stick yourself first thing upon arising after not having eaten overnight, then you probably are pre-diabetic as well. Polycystic ovarian disease or breast disease, systemic inflammation, inflammatory processes, or a tendency to form blood clots, all could be indicators that you have prediabetes. Now we've mentioned gestational diabetes. Just remember, it's similar to type 2 and occurs during pregnancy. And 70% of these people will develop the full-blown type 2 diabetes. As we said before, type 2 diabetes represents 95% of diabetics. The body produces insulin, but the cells resist that insulin. We're going to talk about that in a few minutes. The body responds in turn by producing more insulin, and these insulin levels rise until finally the body's no longer able to produce enough insulin to overcome the resistance in the body, and you develop the symptoms of diabetes. So those symptoms are, first of all, you may have no symptoms. You may not know that you have diabetes until you go to the doctor for a routine physical or checkup, and he checks your sugar and says, you've got diabetes. Or perhaps you're just feeling a little fatigue. Fatigue means you're just tired all the time. You just don't have the energy that you used to have. Increased thirst is another problem. And then increased urination goes right along with that. These people may feel like they have to go to the bathroom and empty their bladder every 30 minutes. And it's like, what's going on with me? I don't understand. Anytime that you have a blood sugar greater than 200, you're diabetic. Or if you have a fasting blood sugar that's greater than 126, confirmed 2 times, you're also diabetic. 80% of the people who get diabetes will develop heart disease. 68% of those will actually die from it. Diabetics have stroke 2 to 4 times greater frequency than the general population. 67% of them experience hypertension problems. 28% will suffer from blindness or eye problems. And kidney disease, well, in fact, it is the leading cause of kidney failure. 44% of the new cases in 2008 of kidney failure were because of diabetes. So real problems here. It can also impact your nervous system. Tremendous neuropathy pain, burning, stinging pain in the extremities, in the hands and the feet. And it can extend to your whole body. So 30% of the people will have this impaired sensation in their feet. It often leads to amputations, a tragic thing. It can happen very rapidly. Then there's mobility problems and depression. You're 2 times as more likely to have depression. Diabetic patients, if they're pregnant, will experience increased complications in pregnancy. It can lead to metabolic imbalances such as ketoacidosis or hyperosmolar coma, and it can lead to more dental problems, 2 to 3 more times likely to have dental problems than the standard population. So this brings us down to a new term that you may run across in the literature. It's called diabesity, and it's actually a more accurate name to describe the syndrome because it begins with the insulin resistance and goes clear down to the type 2 diabetes. It actually is all the same disease process brought on by our lifestyle. Let's talk a little bit now about insulin resistance. To reverse diabetes, you need to understand what insulin resistance is, and it all starts in the cells in your body. The body has about 3 billion cells, and each requires energy to function. They need sugar or glucose for energy. Now, in this seminar, I will sometimes use the word glucose. I will sometimes use the word sugar interchangeably, though they're not exactly the same thing. Sugar is the more common term that everyone talks about. You break the sugar down into its components, and part of what you have is glucose. But that's what the cell needs to operate. The brain has to have it in order to be able to function. So as you take on a meal, this cell needs assistance to get the sugar in, to open up doors, as it were. And I like to think of the cell membrane as a subdivision. You're looking down on it from the air. There's thousands of little houses out here. And as you look at each house, it has doors on it. And the cell has numerous doors on it, like front door and back door, side door, and whatever else. But the problem is, all of those doors are locked. Now let's run through the scenario of what happens with diabetes. You eat a meal, the food comes down into your stomach and then moves on into the intestines. From there, it is absorbed into the bloodstream. And as it's absorbed there, your blood sugar begins to rise. Now, underneath the stomach, on the left-hand side of your body, is a little organ that's called the pancreas. And it's like there's a watchman down there that constantly is testing the blood to see if it's sweet. And when it discovers that the blood is sweet, it sends out a signal to the guys that are working down there, pump out insulin. There's lots of islet cells that are located throughout the pancreas that empty into little microscopic reservoirs. And when these islet cells get the signal, it's time to produce insulin. They produce insulin. Those little micro reservoirs squeeze down and secrete out the insulin for this big sugar rush that's coming into the body. But the problem is it's circulating in the bloodstream and it can't get in the cells because you remember the cells, the doors to the cells are locked. They can't get in. But we need a key. Insulin comes along with the key, sticks it into the door, reaches in and punches the door, opens that door wide so he can throw in his sugar load. He throws in his load, locks things back down, and runs on down the street to do it again. Now, once the sugar is in the cell goes to work and it burns that sugar for energy. Now, this represents a little furnace, and So the cell takes the sugar, throws it in there, produces the energy it needs for bodily functions. But any excess that's left over, it stores as fat and puts that in reserves within the cell itself in the form of glycogen. Now, this is a normal process again. You eat a meal here. And once that food begins to be absorbed, the blood sugar rises. The pancreas detects the rise in the blood sugar, so it goes to work and it secretes insulin. Now the insulin is excreted into the bloodstream, circulates through the body, and it unlocks the doors to the cells, throws the sugar in. Once the sugar is in the cell, the blood sugar levels return to normal. Blood sugar in and of itself is actually toxic to the body. You might think of it as being equivalent to the inside of the blood vessels being sandblasted when those levels are high. So it's important to bring those down. So the body does its best to bring that back into normal, and then the cell uses that sugar for energy to fuel its processes, and hopefully that and the reserves will last you until you get your next meal, when you eat the food again and the process goes all over again. But what happens when the cell gets all the energy that it needs? Insulin isn't asking if it can open the door. It just indiscriminately opens the first door it comes to and throws the sugar in. We have insulin resistance that occurs after a period of time. And in the cells, when the sugar level in the cell rises, it gets to the place where the cell just doesn't need any more. So it's like the cell takes some of that excess sugar, makes gum out of it, and takes that gum and puts it into the lock of the cell. Now when insulin comes along, sticks his key in to try to do his work, he can't. So that's where this comes in. And so you begin to develop an insulin resistance cycle because you're gumming up the locks. So when you eat a meal, blood sugar rises, pancreas secretes even more insulin. There is more insulin for the fewer doors that are available now because the cells have gummed up some of the doors. They don't need it. And because insulin levels rise, we still get the sugar in the cell. And the cells now are overfed, and they have to take that excess and continue to store it. So they use some of that excess to gum up more locks. And as more locks are gummed up, there's less doors for the sugar to get in, and the cycle repeats over and over and over again until you finally your pancreas just becomes fatigued. Then when you come along to put the glucose in the cell, now what? So the muscle and fat cells are gummed up, and insulin reduction is maxed out, and your blood sugar begins to rise, and your doctor says, you've got diabetes. So type 2 diabetes is an insulin-resistant syndrome where energy intake over a long period of time, sometimes as much as 20 years, is in excess of energy spent. And this messes up the metabolic cycle in the body. It becomes a terrible metabolic mess. There are several things that we can do to treat diabetes. By far, the most effective way, in my opinion, to treat diabetes is something that we call diabetes self-management education. That's what we're doing here. We're teaching you how to manage your own diabetes by controlling your lifestyle. I work with a physician who's actually the medical director of our program, Dr. John McKeown. And Dr. McKeown says it's 10% doctor and 90% patient. The second most important thing is diabetes self-management support. Again, this is something that you have to do. Become involved with diabetes support groups. Help other people learn the same information that you're learning on how to reverse and control this disease. We've got a huge problem here. And then the last thing that you should be doing is seeking medical treatment, albeit is a very important alternative. And I want you to understand that this program is for educational purposes only. It does not take the place of your doctor. You are responsible for going to your doctor, for letting him work with you to manage your medications based on what your particular set of symptoms are. So let this be an adjunct to that. Tell him that you're working to change your lifestyle, to increase your exercise, to make dietary changes, to reverse your diabetes, and he will be happy to help you do that. But this should not be our first line of treatment. Our first line of treatment is modifying the lifestyle where the problem exists in the first place. So let's, medications and insulin, they're just simply tools that the doctor has in his toolbox to help you control your symptoms. He doesn't reverse your disease. Only you can reverse your disease. If you continue the standard way, once you receive the diagnosis of diabetes, if you don't make lifestyle changes, what you can expect is an ever-increasing regimen of medication. And you can expect all these complications that we talked about. They will come your way. Your doctor has several classes of medications that he deals with. Some of these are good, some of them not so good, but again, these are the tools that he has in his toolbox. There's the B's. I call them the B's. You can pronounce the word if you want to, but what we're trying to do is give you something you can understand. It's a class of medication, though, that decreases insulin resistance. And you may be taking a medication like, for instance, metformin. You might think of it as household oil. It's partially effective. You know, if you have some gum in the lock, maybe if you put some household oil in there, you can slick things up enough that the key will work when you stick the key in the door. It's partially effective at reducing your insulin resistance and helping the sugar get into the cell. Then we have the S's. The S's act like a slave driver. He's there with his whip, and he whips the pancreas, forces the pancreas to produce even more insulin, and ultimately drives it to the place of pancreatic fatigue. But these are drugs like glimepiride, Dibeta, glyburide. And it's a class of drugs that help control your symptoms. If you're not willing to make changes in your lifestyle, absolutely you need to stay on these. That's the best option you have. But if you can actually make changes in your lifestyle, it won't be long until your doctor is saying, I think we need to decrease your dose, because we see this happen all the time. And finally, there's the T's. The T's simply improve the effectiveness of the insulin, and they're drugs like Actos and Avandia. So that works for a while, but the cells still have enough energy if you haven't made the lifestyle changes. So what happens when that stops working? You guessed it. You get to go on insulin. And it's not a happy progress. That is, you get to go on insulin unless you take charge of yourself. Only you can reverse your diabetes. It's 10% doctor and 90% patient. So your doctor can only treat your symptoms. He can advise you to lose weight. He can advise you to eat less. He can advise you to get more exercise. But that advice does little good unless you do something about it. So ultimately, the choice is up to you.
Hi, I want to talk with you about exercise. How many of you love to exercise? Well, exercise is something a lot of people don't really enjoy doing, but it's something important for us. You know, the CDC's physical activity guidelines for Americans recommends at least 150 minutes a week of exercise, or up to 300 minutes a week if you want to lose weight. That's a lot of time. That's basically 1 hour, 5 days a week. Wow, who has time for that? Well, what I want to share with you right now is a new way to exercise. Is it new? Or is it just new the way they're looking at it nowadays? Basically, what it is it's 9 times greater effects than if I was running on a treadmill or running down the road. For that specific amount of time, I would have 9 times greater benefits. Wow! Would you not be interested in that? It's called burst training. Burst, a short amount of exercise, rest, then a short amount of exercise. It's kind of like when we were kids. Some of you may remember. We would run and chase Johnny. Once we caught Johnny, we're out of breath. We'd take a little bit of time to catch our breath, and when we caught our breath, we'd take off running again. Well, kids do that. Adults many times don't. We get on the treadmill and we run forever and ever and ever, like, oh. Burst training, or another name for it is interval training, is more healthy for the body. Benefits that are much greater than that long endurance exercise. What we're talking about is only 12 minutes 3 times a week. You might say, what? Only 12 minutes long? Yes, and the benefits are very great. Compared to treadmills and hour-long aerobic classes, burst training helps you burn fat more efficiently and more quickly. This is up in Canada. They did the research and they said burst training is important. You need to implement this in your daily life. But first, it's important that you talk with your doctor. You don't want to start an exercise program if you're physically not prepared for it. What burst training is basically is vigorous exercise, 20 to 60 seconds. My advice is to start out with less, 20 seconds of vigorous exercise. What does that mean? That means exercise until you're out of breath. And then you catch your breath, okay? It's important to build up. So you start out with 20 seconds. Over time, you can build up to 60 seconds. Rest for 1 to 2 minutes or until you catch your breath. It's good to have a watch. It's good to stay focused on that, okay? So I exercise. Okay, I've done it my 30 seconds. Now I'm going to catch my breath in 1 to 2 minutes. And when I've caught my breath, then I go back and I do that same exercise again or something different. Something that's going to get me out of breath in a short amount of time, okay? So basically, exercise for 20 seconds, rest for 1 to 2 minutes. Repeat that. Exercise for 20 seconds, rest for 1 to 2 minutes. I repeat that again. Exercise for 20 seconds, rest for 1 to 2 minutes. You're seeing what I'm going through right now, okay? Here we go. You continue that routine. Exercise, rest, exercise, rest, exercise, rest. Basically, your goal is to do 5 to 10 sets of exercise, then rest. Now do this every other day. If you want greater results, you can do it every day, but you really don't need to do it every single day, okay? Basically, 3 times a week is what you really need to do it. Because this exercise, burst training, will burn fat for 48 up to 36 hours after you've done your exercise. Why every other day? That's a good question. I talked about that, the 36 to 48 hours. That's something people are like, wow, that's astounding, because regular exercise doesn't do that. But burst training does do that, okay? Basically, mark your calendars. Monday, Wednesday, Friday. Say, hey, I'm going to take time out of my busy schedule, 12 minutes a day. That's not much. You can do that. Do you mean just 12 minutes of exercise 3 times a week? That's exactly what I'm talking about. Yes, just 12 minutes 3 times a week. Remember not to eat for 2 hours after you exercise. You might be like, what? Why not? Well, the amazing thing is when you exercise, you're burning calories, you're burning glycogen, and your body is looking for more energy. Well, if you eat right after you exercise, your body says, there's that energy, and it uses that. So it's actually very important not to exercise for 2 hours, because your body then is looking for an energy source, and it starts breaking down fat to use for energy. Vigorous exercise, 20 to 60 seconds. We talked about that. Then you follow it with rest for 1 to 2 minutes. And then you repeat this 5 to 10 times. Do this every other day, and don't eat for 2 hours after exercising. It's just that simple. You can do it in your house. You can do it outside. You could even do it at work. Stairs are great. But some of you may be like, hey, my knees hurt when I walk upstairs. Are there other ways of doing it? Yes, there's many ways to get that burst training done. How does burst training work? Okay, burst training involves these short 20 to 60 second bursts at high intensity where oxygen demand is much higher than your body can supply. It's more, and you're out of breath. That's the important part, okay? The metabolic stress this creates for your body to repay that oxygen debt means you burn fat, more fat in less time. More fat in less time. That's important, okay? The Applied Journal of Physiology showed that burst training causes fat to be burned for exercise, after exercise, for 36 hours. That's a long time. 36 hours. You will have muscle building, not muscle wasting. You become more toned and more fit. There is increased sensitivity to insulin, which means more sugar burning, which helps both the diabetics and people who don't want fat stored on their hips and thighs. Important to try. Here's some of the health benefits of burst training. Increased fat burning, we talked about that. Not just glucose is burned, but fat is being broken down and burned. Increased lean muscle mass. Okay, so you're having a buildup of strong, healthy muscles. Improved cardiovascular health. Interesting. Healthier heart. Is that not important? Combined aerobic and anaerobic activity. It's not just aerobic, it's also anaerobic also. They're combined because you kind of get out of breath. Increased feel-good beta endorphins. Wow, you feel better after this exercise. Increased human growth hormone, that anti-aging hormone. I get younger as I exercise. Don't you want that? Increased energy. You have more stamina throughout your day. Improved athletic performance. Athletes do this because they know it works. And reduced inflammation. Your joints aren't swollen and you feel like doing more exercise. Enjoy feeling great. You know, before we close, I do want to share with you how to do it. Let's try that right now, okay? I have some dumbbells, 5-pound dumbbells. Some of you might be like, hey, that's heavy. You might want to try cans of corn or water bottles, whatever you have. But some weights in the hands is really important. And so you can be inside. Outdoors is better. You get fresh air. Maybe the weather's not right. But we're going to start that right now. What I would do is start first with your legs, walking, okay? Or kind of a fast walk, okay? So legs, working the legs, and arms. Curl, curl, curl. Good job. All right, curl, curl, curl. Now we're going to do lift, lift, lift. Good job. Okay, punch, punch, punch. Very good. And lift over your head also. Oh, that one's a little harder. Some of you might be like, wow, that one's a little harder, but you get built up to it, okay? So let's try that again. We'll do it a little faster. Curl, curl, curl. Good job. Here we go. Lift, lift, lift. Doing good. Punch, punch, punch. Over the head. Okay. I don't know about my time. I haven't been watching my time. Is my 30 seconds up? Here, let's try that again. Curl, curl, curl. Take the deep breaths. Make sure you're breathing deep while you do this. Lift, lift, lift. Punch, punch, punch. Over the head, over the head. Okay. Now, I need to catch my breath. Where is it? Oh, I lost it. I better catch it. Okay, catch my breath. Right? 1 to 2 minutes of catching my breath. And when I've caught my breath, I do it again. Let's see. I caught my breath. I'm going to try it again, okay? Here we go. So legs first. Running in place. Curl, curl, curl. Make sure to breathe deep. Punch, punch, punch. Keep breathing deep. That's very important. All right, lift, lift, lift. Over your head. Okay, if you can do it faster, do it faster. But if you're having chest pressure or heart pain or anything like that, you need to stop. Okay, let's see. I can do a little more. Whew. My body's getting hotter. The enzymes are working. I'm becoming an enzymatic machine, enzymatic fat-burning machine. That's important for your health. Thank you.
Thank you, Seth. Now let's talk for a moment about how diabetes progresses. Diabetes actually starts with our standard American diet. It's a diet that's high in refined carbohydrates and saturated fats, and it's low in fiber, vitamins and minerals, antioxidants, and phytonutrients. Now those things we will talk about more in detail as we get into future sessions of this seminar. But let's look at the cyclical process of the disease. Our standard American diet, it is sort of a sad state of affairs, but it causes us to have a high blood sugar, and that in turn results in a high insulin response. Now insulin is a food storage hormone, so when our insulin levels are high and chronically high, as we see in type 2 diabetes, that results in weight gain. On the other hand, the high blood sugar also makes us feel very lethargic. You're tired all the time. You just can't get up and move. And as a consequence, we don't move. We just lay around. We've become a generation of couch potatoes. And that, in turn, with all these calories on board, since we're not burning them off, it also results in weight gain. Now, when our weight goes or when our insulin levels go up, we feel hungry. And when you have excessive hunger, that lends to overeating. And if you're overeating and you're eating the standard American diet, then that feeds back into high blood sugar, which is going to drive the lethargy and high insulin levels. And when your weight goes up and you have these chronically high blood sugars, then, of course, you're going to develop the process of insulin resistance. And that causes blood sugars to go up again. And the excessive weight also releases inflammatory factors in the body. So you have chronic inflammation that sets up housekeeping, alters your metabolism, and results in high blood sugar levels. Now eventually, after you have had chronically high insulin levels for a while, then you're going to have pancreatic fatigue that eventually sets in. Pancreas is just so tired, it cannot keep up with the insulin resistance, and as a result, your insulin levels begin to drop. And when that happens, it also results in higher blood sugar. Now your body's no longer able to produce the amount of insulin that it needs, so your doctor comes along and says, oh, we can help you out, we'll give you insulin. So it gives you, he starts you on insulin shots on a regular basis, and it results in more weight gain. So this is a cycle that we really need to break, and we're going to break that on multiple levels, but we'll have to take that up in session 2.